We're diving deep into a vital test in the field of immunohistochemistry, the TTF-1 or Thyroid Transcription Factor-1 test. This test plays a crucial role in diagnosing various types of cancers, including lung and thyroid cancers. Let's explore everything you need to know about this test, from pre-test preparations to understanding the results. Pre-test information. Before the TTF-1 test is performed, there are a few essential pre-test requirements to keep in mind. First, it is important to provide a copy of the patient's histopathology report. This report gives a detailed description of the tissue's appearance under a microscope, which is crucial for accurate diagnosis. Secondly, make sure to specify the site of the biopsy. Knowing the exact location from which the tissue sample was taken helps in understanding the context and relevance of the findings. Lastly, a comprehensive clinical history of the patient is needed. This includes any previous diagnosis, treatments, and symptoms that might be relevant. All these pieces of information together help pathologists make the most accurate diagnosis possible. Specification of the test. Now let's talk about the specifications of the TTF-1 test. This test is an immunohistochemical stain used primarily to identify specific types of cancer cells. TTF-1 is a highly specific marker for primary lung adenocarcinomas. It is particularly valuable because it helps differentiate between primary lung adenocarcinomas and metastatic adenocarcinomas, which may have originated from another part of the body but spread to the lungs. Diseases associated with TTF-1. TTF-1 isn't just limited to lung cancers. It's also expressed in thyroid carcinomas of follicular origin and thyroid medullary carcinoma. This makes the TTF-1 test a powerful tool in distinguishing these cancers from other malignancies that might appear similar under the microscope but differ in origin. Specimen used for the TTF-1 test. For the TTF-1 test, the specimen used is typically a tissue biopsy sample. This sample is carefully collected from the patient, often from a suspected cancerous site. Once the biopsy is obtained, it is processed and prepared for the immunohistochemical staining procedure. Components included in the test. The TTF-1 test includes several components. Primary antibody. This is the TTF-1 antibody, specifically designed to bind to the TTF-1 antigen present in certain cancer cells. Secondary antibody. This binds to the primary antibody and is usually linked to an enzyme or a dye that will make the target antigen visible under a microscope. Chromogen. This substance reacts with the enzyme linked to the secondary antibody to produce a color, which highlights the presence of the antigen in the tissue. Test report time. One important aspect to note is the test report time. For the TTF-1 test, the typical turnaround time is about 7 days. This allows the laboratory to carefully process the tissue, perform the staining procedure, and analyze the results to provide a comprehensive report. Understanding the TTF-1 test results. So, what do the results of a TTF-1 test mean? A positive TTF-1 stain indicates that the cells in the tissue sample are likely from a primary lung adenocarcinoma or a thyroid carcinoma. However, a negative result doesn't completely rule out these cancers, but suggests that other markers might be needed to further clarify the diagnosis. It's always important to interpret these results in conjunction with the patient's clinical history and other diagnostic findings.